Thank you for staying with us. I was just checking to be sure that we are ready for you for Citizens Microphone today. Now, we told you earlier that doctors at the Komfo Teaching Hospital say they will be embarking on an indefinite strike over what leadership describes as harassment and persistent orders to move out of their Danyame residences in Kumasi. Nana Boache is live now, and we know that Joy News, we are reliably informed that many of the doctors have received notices asking them to move out of the official bungalows because they have been sold out. So Nanaya Boache, if you can hear me, what's the situation on ground and what are the citizens saying?
An indefinite strike over what the doctors claim to be a forceful ejection from their accommodation around the Denyame enclave here in the Ashanti region. Well, the strike action begins today. We would be looking at how the strike would be biting hard on patients who are in at the Komfo Teaching Hospital to seek medical attention. Would also be engaging the management of the hospital. But before then, we have with me the president of the Komfo Teaching Hospital Doctors Association, Dr. Michael Leet. Yesterday, in our engagement, he made mention of their reasons for embarking on this strike. He says that it is due to the forceful ejection. Notice was not really given to them, and this has been going on for quite some time. A private developer, we are told, has access to the land right now, making a forceful attempt to eject the doctors from their accommodation. So we have with me Dr. Michael Leet. Doc, your strike begins today. Someone would say, what are your concerns?
Okay. We didn't say we are on strike. We just wrote, we notified management that we are going to look for accommodation units. That's what we are saying. We are not on strike. If you look at our letter, it said we were informing management that since we are being evicted from our accommodation units, we want to go out and look for accommodation.
You are not on strike, but you are not coming to work. You are going to look for accommodation. That's definitely what we would put in a strike.
No, we didn't say on strike. You see, you inform your managers, your central management, I just can't leave. So I'm going to look for accommodation. That's what we're saying.
So in your to look for accommodation, you're not coming to work today?
I'm in Komfo. I'm seeing the inpatient, but we are not receiving any outpatient. That's all. The patients within the hospital are being seen. The old ones are being seen. But we are not going to take on any other patient, any new patient into the hospital.
But then what are your concerns mainly? Is it just about the accommodation or there's something to it?
No, it's just about the accommodation. I mean, you're supposed to provide that an alternative. We move in before you finish whatever you are building. But you are there and somebody just come into your room. I bought the land, so you need to be evicted. Some have had their power sources cut off. Some have had their water sources cut off. So, and these are not just mere doctors. These are leaders of the hospital. You have the neurosurgeon, Dr. Frank Ketiabuachi is here, who is a neurosurgeon, is affected. You have Paukwesi Bedu, the HOD of the Trauma and Orthopedic Directorate, another heads of department, the cardiothoracic surgeon. Those are the caliber of people who stay in this accommodation unit. So it's fair that even with the rent control, you don't just give somebody one week notice to evict. You give about six months or six. I mean, there's a period for you to give the person to prepare and leave the accommodation. So we are not on strike. We need a place to sleep. And if you're a victim, I don't think I have the peace of mind to come and see any patient. It's that simple. So today we are going to meet management and other stakeholders and some of the private developers to come out with an amicable solution to this one.
Even before your engagement with management and the developers, the regional minister says there is nothing. A forceful eviction.
I think I said it yesterday and I want to repeat. I don't report to the regional minister. I've not heard what he said. If you continue to say what you want to say, we are going to see the management. So thank you.
All right, and that is Dr. Michael Leeds. He is the president of the Komfo-Anokye Teaching Hospital Doctors Association. He says that they are not on strike, but they are not receiving outpatient. They would only be attending to inpatients just to seek accommodation. So if they are being evicted from their accommodation at the Denyame Enclave, then they would also not be here at the hospital. They would only be seeking accommodation or looking for accommodation elsewhere. We are currently at the Komfo-Anokye Teaching Hospital. We've been told that the Doctors Association, the president himself and other executive members of the Doctors Association will be meeting management of the Komfo-Anokye Teaching Hospital to come at an amicable solution to this impasse as to whether or not they would continue to boycott their work today or not. The Komfo-Anokye Teaching Hospital PRO Kwame Frimpong, who is not here with me, I spoke to him earlier, says that the management is looking at concluding the meeting today, which would definitely bring a stop to this strike action. Well, Dr. Michael Leeds says he's not reporting to the regional minister, who earlier stated that there is nothing like a forceful eviction. The regional minister yesterday told Joy News that there is a building which is at the Denyame Enclave, which is to be completed in 2 years' time. It started last year. It should be completed this year. And so a 1 week notice they claim.
That's Nana Boachi Adom at Denyame. You should excuse me, please. But we'll go back to him briefly for more reactions from the citizens. In the meantime, welcome back. So Nana Boachi Adom is back with some patients at the hospital. Let's get back to him now. Nana Boachi Adom, if you can hear me, what are the patients saying?
Was made here at the OPD center of the Komfo-Anokye Teaching Hospital that the doctors are on strike, and so patients would have to be rescheduled. This is the OPD center. You can see that some patients are still seated here waiting to hear from their doctors, which we are told is not going to happen because the doctors are on strike. They would not also want to leave because some of them are in some serious conditions and would want to seek medical attention. But then we have some patients here would be speaking to. They have been here since morning, and when the announcement came in that the doctors are on strike, they've been stranded, sitting here for quite some time, hoping that at least one doctor could come out to attend to them. But for about 30 minutes now, there have not been any resolution whatsoever. And so at the OPD center, some patients seated here stranded, waiting for some doctors, if possible, to come and listen to their concerns. But we have been told that that is not going to be possible. I have this gentleman here with me. What about time, babe?
Past 6 o'clock.
Past 6 o'clock. Mobile no, edeno makachemo.
Yeah, by in the kind at the card called 20 himself doctors, beba. By it's one around by 7:38, and the nurses now because the doctors call strike. Into a more reschedule our date near day by review no amaye. Into the free near a next month 10th April. Say and on a yensa review.
Modemo data was some bana akoshe 10th April semombra. Almost say omo issue nyana say.
I must say doctors no strike concern baby omo ti tu omo. And now omo de call strike no. Sana omo yateno.
Okay, so he is saying that he came here around 6 a.m. When he came at 6 a.m., an announcement was made that the doctors are on strike due to the forceful ejection from their hospital accommodation. He says that he came in with his wife, who is not really feeling well. They came to seek medical attention, but then the doctors are not in the hospital at the moment due to the strike. But let's speak to the patient herself. Mepacho, me who say online na eye wo ya kakra 10th April near Sebra ubitimi anya hoden atwen 10th April no
ana mentimi hu de say ye bekọ be fofora na say ye betwen de a me mentimi hu je say me kuno
say undro ne oniema wo hia nyina no e wo ho a e betimi sustain ni wana
asakola
undro nyina asa
to say menim say bekọ akoto bi say ye betwen yo ene de mentimi hu
and then omo ka say bra review
pachan
and na wo buy enso so omo say omo ko strike
pachan
it is say no e den na mo be
ene de me de menim de meye de
Well, she is the patient herself. She says that she doesn't know if she would be able to stay strong up until the 10th of April, which we have been told that she's been told to come back to the hospital. But mobile score private hospital and I say mobile 10th April no.
Yeah, you can't call it me refer near the emergency. And you say if you are make quite now my coma among the stage of it. Ebi a no mo and no be on prescribe am ya ne akoto because say oni aduro ba akokra onom ntimi so mentimi emmo ma adwemu ma na aduro nti ye say den a me pe doctor bi na me hunu na ochoro no bi ma me na me de ma no na kopim da omo time ne be so no ya san ba.
Well, they are saying that they would have to go to a different hospital. Looking at her condition is not really good. She really needs medical attention. She has no drugs, and so they have to go to a different hospital for a different doctor to prescribe drugs for her. You can see that she has a wound on her leg, and she really needs critical medical attention. But then we are still here at the OPD center of the Komfo Teaching Hospital. The strike is biting hard on patients who are in to seek medical attention. We've been told that the doctors would not be available today due to the strike, and some of the patients are stranded. Some of them would have to go to a private hospital. The nurse here is also speaking to a patient to go to a different hospital because the doctors are not available at the moment. So, sweetie, the condition here at the Komfo Teaching Hospital is, and patients are very, very much stranded. Eja, me pacho, oba ha time be?
Ba how much? 5.
Okay. Na oba ha much 5 no doctors for abi abehwe wa na say obi no aka bibi.
Obi ama doctor bi ama no answer date no bi ama e.
Oma reschedule won so.
O say
omo de wako shada foforo.
Da foforo.
Omo se brother be.
Na otwimi no
2 weeks time. Na watwimi no obetimi anya ahoden atwen na watwimi no.
Enye se ne nyame no na be kire. Se ba bi a ide wo mu na ehwe me ba bi a yare no this wo mu a. Surgery na so mo ye me.
Okay. What's some year with surgery, but to see your money or more strike in the what's our cobana watching me,
no, because almost share me ne. And the mamma too almost so until your mom now watching me, next phone.
Announcement no my no more can say.
Almost obia magic date. And a dance will be our da or deba. Until you know, our mamma will be a date at the court. So on coffee. Date ne so na se oba na so ma ba de a ne ahwe.
And you know obekọ private hospital ana say no obetwen omo aso beba.
Metwen omo a. Metwen omo kosi. Metwen date na de ama me no. Kosi.
All right, so he is also coming for a surgery, but when he got here, he's been told that the doctors are on strike. A very a sad one, because somebody coming in for surgery and being asked to go back, you definitely know how hard it is going to be for him. But then some of the patients are still here, hoping that any doctor could come around to listen to their concerns, but we've been told that is not happening. They are packing the chairs. You can see the nurse that's packing the chairs back into the offices, which is to say that there's not going to be work today, and so everybody should move out of the OPD center here at the Komfo Teaching Hospital. But then some stranded patients are still seated here. They do not want to leave. Majority of them who are in critical conditions would want to stay here and definitely, or if possible, hear from any doctor who would be coming in to listen to their concerns. And so, sweetie, this is the situation here at the Komfo Teaching Hospital. The first day of the strike by the Komfo Doctors Association over what leadership describe as forceful ejection from their hospital accommodation. This thing has been going on for about 2 years now, but then it has gotten out of hands, which has led to the ongoing strike by the Komfo-Anokye Teaching Hospital Doctors Association. Dr. Michael Leet, who is the president, has said that they are not coming up until they do hear something from government. Right now, management of the Komfo-Anokye Teaching Hospital and the Komfo-Anokye Teaching Hospital Doctors Association are in a crunch meeting to determine whether or not they would continue their strike or they would resume. But then we have been told that they are receiving inpatients to at least compensate the hospital for coming in or hearing some part of their concerns. But outpatients would not be allowed to have any meeting whatsoever with the doctors. So the situation here at the Komfo-Anokye Teaching Hospital. Over to you, sweetie.
Thank you, Nana Boachi Adam, for painting a clearer picture of the situation there. And you do not want to be in the shoes of these outpatients sitting there not knowing what's going to happen, what their next step is, and having come to a hospital to seek medical attention. That is the plight of the citizens today at Komfo-Anokye Teaching Hospital. And so we await to see what the doctor's next move will be, and we'll keep you up to speed on that. Right now, we'll take a break, and when we return, there's more.